All right, good afternoon, everyone. Welcome to the Health and Social Services Subcommittee of Appropriations. We are missing a few members because they have bills in other committees, which is that time of year. But we're going to go ahead and get started anyway. We have two budgets today to hear testimony on, so we will start with the Maryland Health Benefit Exchange and the report from our analyst. Morgan, take it away.
Thank you, Mr. Chairman and members of the committee. My name is Morgan Smith, and I'm presenting the operating budget analysis on the Maryland Health Benefit Exchange today. The Maryland Health Benefit Exchange provides a marketplace for individuals and small businesses to access affordable or no-cost health insurance. And in fiscal 2021, their budget increases $40.8 million or 7.1% to $615.4 million. On page 2, you'll see a short discussion of the proposed deficiencies for fiscal 2023. Of these deficiencies, there is one that totals $7.5 million, and that is for increases in the fulfillment and consolidated service center contract rates. Important to note here is that about half of this money is in general funds, and this is the first time that MHBE has received general funds since 2016. Because of this, DLS is asking MHBE to comment on whether general fund support is expected to be needed in the future for the agency. Moving to page 3, you'll see Exhibit 1, which shows the overview of agency spending. As I said before, the allowance totals $615 million, and of which 86% supports the reinsurance payments and the Young Adult Subsidy Program. The Young Adult Subsidy receives $10 million, which you'll see in the pie chart. And this is the final portion of funding authorized for this program from chapters 777 and 778 of 2021. Moving to the next page, Exhibit 2 shows the remaining 14% and how it's distributed across information technology and administration. Information technology totals $39.5 million, while administration totals $46 million. And on the side, you'll see a breakdown of what falls under administration, the majority of which goes to the call center at $13.5 million or 16%. And then the remaining uses include other administrative uses, fulfillment, connector entities, and marketing and outreach. Exhibit 3 on the next page shows the major changes in the budget. This is under the proposed budget exhibit. And I just want to highlight that there's $52.3 million for reinsurance payments, which is partially offset by a decrease in $10 million for the Young Adult Subsidy. As I said before, the Young Adult Subsidy was a pilot program that was the funding for which was spread out across 3 fiscal years. It received $20 million last fiscal year in 2023, and then in 2024, it's receiving $10 million, which is causing this decrease in the Young Adult Subsidy Program that you're seeing. The other biggest change in the budget is a decrease of $1.6 million that you'll find towards the bottom, and that's for server utilization costs for the Amazon Web Services as it relates to MD Think. Moving to page 6, you'll see the personnel chart. Important to note is that MHBE saw stable personnel between the fiscal 2023 working appropriation in the fiscal 2024 allowance at 67 regular positions. And as of December 31st, 2022, MHBE only had 4 vacancies, and of which only 0.38 is above their budgeted turnover. Moving to Exhibit 4 on page 8. Chapters 6 and 7 of 2018 established the state reinsurance program, and that was to address rising health insurance premiums across the state of Maryland. MHBE was required to apply for a state innovation waiver under Section 1332 of the Affordable Care Act to receive federal pass-through funding to support the reinsurance program. It was approved in August 2018, and in December 2022, MHBE submitted their letter of intent to request a 5-year extension from the projected end of plan year 2023 to now 2028. Approval of the Section 1332 waiver and the availability of federal pass-through funds for the state reinsurance program reduced individual market premium rates approved by the Maryland Insurance Administration. Exhibit 4 provides sample monthly premiums for an individual aged 40 in the Care First Blue Choice plan. Important to note here is that these plans represent the lowest cost at each metal level, with the bronze plans increasing the most at 8.9% and silver the least at 3.8%. This is the second year since the reinsurance program began that sample rates have expected to increase, but all rates are still below those of plan year 2020. We'll now move to Exhibit 5 on page 10. Exhibit 5 is titled Federal Pass-Through Relative to Reinsurance Costs. In the 2022 Joint Chairman's Review, it was requested that MHBE provide information on the funding and financial situation of the state reinsurance program. And MHBE provided information that showed that the program's financial status had changed since the inception of the program, at which point federal funds were projected to be sufficient to cover costs through 2023. However, total program costs have exceeded those projections by about 8%. And that's primarily due to the ongoing COVID-19 pandemic effects. Simultaneously, program cost projections have increased while federal funding for the program has decreased. The federal funding calculation has changed for various reasons, but most importantly, there was a decrease of 27% due to the impact of a third carrier entering the market. To that end, Exhibit 5 shows the actual and estimated reinsurance costs and federal pass-through allotment from calendar 2019 through calendar 2025. In calendar 2021, the program was roughly level funded, with revenues slightly exceeding expenditures due to ARPA funds. However, starting in calendar 2022, the annual cost of the program will exceed federal pass-through revenue by about $175 million. Moving to Exhibit 6, this is at the beginning of page 11. Exhibit 6 shows the balance of federal pass-through dollars and the provider fee. Due to the decrease in available federal fund pass-through expected, MHBE will first draw down available federal fund balance and then utilize the assessment revenue and fund balance to fill the gap. The small bars on Exhibit 6 show that federal pass-through balance, and then the provider assessment balance, you'll see, is also decreasing. By calendar 2025, estimated state-funded revenue costs will exceed the new assessment revenue by about $30 million, indicating that the state must be cautious going forward in committing the fund to other endeavors. In particular, in the 2021 legislative session, legislation was passed that committed the reinsurance funds to other purposes, and these are listed at the end of page 11 and onto page 12. These additional uses of the reinsurance funds are also contributing to this decline seen in Exhibit 6, where the fund balance is estimated to reach a low of $284 million in 2025. We'll now move to page 12, Exhibit 7. Exhibit 7 shows the enrollees in qualified health programs by age. The fiscal 2024 allowance includes $10 million for the Young Adult Subsidy Program, which I spoke about previously, and that provides reduced cost health insurance coverage for young Marylanders between the ages of 18 and 34. As I noted before, chapters 777 and 778 of 2021 created the state-based Young Adult Health Insurance Subsidies Pilot Program, which is also referred to as the Young Adult Subsidy, and it was set to expire after 2 years. The program was funded at $40 million, which was spread out across 3 fiscal years, and the exhibit shows that there were marginal increases in several key populations, including those under 18 and the 26 through 34 category. DLS asks MHBE to comment on the future of the Young Adult Subsidy Program plans, including a discussion of pilot results as they move forward with this program. Finally, on page 13, Exhibit 8 shows the Maryland Health Connection enrollment, and in 2023, Maryland saw enrollee numbers that exceeded 183,000. This is an increase, of course, over the last several fiscal years, and also on this graph, you'll see a line that indicates the Maryland uninsured rate, which has been stable at about 6% for quite some time. This is one of the lowest uninsured rates in the nation. Finally, on page 14, you will see 2 recommended actions, one of which is a piece of narrative that asks MHBE to notify the budget committees if an application for state innovation waivers is submitted and decisions on those applications. Important to note is that because MHBE submitted that letter of intent recently, I believe that there is a deadline of the end of March to submit that waiver application, so we should be seeing one relatively soon. And then the second piece of narrative is, again, annual language that asks MHBE to monitor and report on the costs of the reinsurance program and future funding needs so that we have a better idea of spending and funding needs as we move forward. And with that, I conclude my presentation, and I'm happy to take any questions you might have.
Wonderful, thank you. Any questions for the analyst? Seeing none, I'd like to bring up Michelle Eberly, the Executive Director of the Health Benefit Exchange, and any member of your team that you would like to join you.
Good afternoon.
Good afternoon. Please begin when you're ready.
Thank you, Chair Resnick, and good afternoon, committee members. Thank you for giving us the opportunity to come speak to you today about the budget before you. I have with me Tony Arminger, who's our Chief Financial Officer, so he's here if we have any questions for him. The mission of the Maryland Health Benefit Exchange is to improve the health and well-being of Marylanders by connecting them with high-quality, affordable health coverage through innovative programs, technology, and consumer assistance. In the decade since our inception, MHB has brought health coverage to millions of Marylanders. You, our legislature, helped along the way by enacting several of our programs. The state reinsurance program, which has reduced individual market premiums by more than 25% since 2019. The Easy Enrollment Program, which allows uninsured individuals to get connected to health coverage by checking a box on their state tax return or when they file for unemployment insurance. And this has provided coverage to over 10,000 additional individuals. And then finally, through our state premium assistance program for young adults, which has been in a pilot phase for 2 years, and it has provided an average of $40 for young adults, and it has increased our young adult young adult enrollments during our previous open enrollment by 7%. These programs, along with technological innovations, focused outreach and marketing efforts, and consumer-driven customer service, has provided 1 in 5 Marylanders with quality, affordable health insurance. Included in your materials today is our 2022 annual report. This report provides a wealth of information on our activities and successes last year. We continue to be a very successful agency and provide vital services to Marylanders as a very small agency with a relatively small budget. As the budget analysis reports, we have 67 state staff. We are very stably positioned with our staff. I think right now we have 1 vacancy that is ready to be filled in a couple of weeks. And we operate on limited state funds with supportive federal funds. It's important to note that our funds are divided into 3 basic programs. Program 1 is for all of our operations, so that's everything besides information technology. Program 2 is information technology, and then Program 3, which is reinsurance, which makes us appear to be a very large funded agency, is pass-through funding. That money comes in from the federal government and from state reinsurance or state assessment dollars, and we pass that through to insurance carriers to pay for their high-cost claims that they incur, which allows us to keep premiums down for everyone. So that money is not dedicated to anything for operations or IT support. We've been asked to address 2 specific questions. The first of which is to comment on whether general fund support is expected to be needed in the future for our agency. And as you know, we had, when we originated, we had a budget that was statutorily at minimum $35 million for our state funding. That subsequently was reduced to at $32 million, and we know that we will always need additional funding above and beyond that. Partially, we had a couple of contracts which we knew were going to expire in 2022, and we had to renegotiate those, and we knew they would be coming in higher. We had planned on that for our call center contract, But what caught us by surprise was our fulfillment contract. And during the time of inflation, for cost of paper and cost of labor, that contract went up substantially. In addition, just annual cost of living adjustments and costs that come down through the state pass-through that we have to pay for other services like Department of Information Technology, that will continue to increase that. So although we operate very fiscally responsible, we do know that we will need general funds, and we've been advised that we will receive general funds for our deficiency for fiscal year 23, and I believe there are general funds in for the fiscal year 24 budget. And I do want to point out that the money we get from Medicaid, which helps support our efforts, much of that funding is 90%. It's called 90-10. So we pay 10% and they pay 90%. And that's primarily for our development work. So when we look at losing state funds, we have the risk losing significant federal funds. The second area we've been asked to comment on is the future of the Young Adult Subsidy Program plans and the pilot results. This legislation was passed in 2021. We've had a 2-year program. This is the last year of the program. Young adults are eligible to receive the state subsidy if they are between ages of 18 and 34 and have below 400% of the federal poverty level. That's a graduated scale, so the less they earn and the younger they are, the more state subsidy they would get for that program. In 2022, about 45,000 young adults in Maryland received premium support from the pilot program, reduced their average household premiums by 34%, from $106 a month to $70 a month. We saw growth in that young adult enrollment year over year by about 11% as of the end of January. It outperformed growth in our other age groups, which overall were 8%. It was the largest such increase we had in young adult enrollments in over 4 years. Young adults comprise more than 24% of our total new enrollees, and that's compared to 4% the year before. Why that's important is when you have an insurance pool of people that you're paying medical claims for, you want to be sure that that pool has a lot of young, healthy people in it to offset older, higher utilizers of medical claims. So that's been really good. We also found as of December 22nd that young adults were less likely to drop coverage compared to the prior year when the subsidy wasn't in effect. We call this the stickiness, how many people stay around. And we had really good success on that. The number who dropped fell 3%, even though among enrollees of all ages, the number who dropped rose by 9% compared to the prior year. So that was a good indicator of that subsidy. We also found that the young adult subsidy recipients compared to young adult enrollees ineligible for the subsidy were more likely to be Hispanic, 14% with subsidy versus 9% without. Our Black African American population, 22% versus 16% without, and female, 57% versus 54% without that subsidy. What's important to note about the continuation of this pilot program is that there is a bill out there now, House Bill 814, to continue it. We are very hopeful that it will continue, particularly because with the public health emergency unwinding, we do anticipate that there will be about 22,000 young adults who will lose coverage because they are no longer eligible, and they have been obtaining health insurance at zero cost. So the lower we can keep that premium, the more likely we are to keep them in health insurance. And with that, I'm happy to take any questions and answer anything you may have.
Thank you. Just a very quick question for me. Anybody else have any questions? Sorry, I assumed. No, just a very quick question. One of the charts demonstrated the number of enrolled population versus the unenrolled rate. The uninsured rate in the state has been consistently around 6%, which is very good for the nation, but that's still somewhere south of about 400,000 Marylanders. So anything that we are doing to close that gap?
Absolutely. Part of that is, one, we do think that there are, again, we estimate 80,000 people in Medicaid that will likely shift over to the qualified health plans. Of course, that doesn't lower that overall percentage, but we will see a growth in that. We know that there is about a third of those individuals are undocumented individuals, so about 133,000 are ineligible to get coverage today. There is another bill that is being presented that would allow undocumented individuals to at least purchase health insurance through the exchange. They would not be able to get federal tax credits, but they could avail themselves of any state subsidies, such as a young adult subsidy. So that we know is about a third. The other 2/3, and again, when we look at the uninsured rate, it's everything. It's employer-sponsored health insurance, it's federal programs, it's public programs, the state Medicaid, it's individual. So there's a lot of pieces to that pie. We have been working very strongly and very focused efforts with the small businesses in Maryland. So that's been an area that we've had challenge with, of getting mostly micro small businesses, those in 5 under, to provide health insurance to their employees. We have some new programs that we've been focusing on where we can help those small businesses either get them into the individual market or help them with getting some other programs, such as it's called ICRA, Individual Coverage HRA program, to help them afford that coverage for their employees. In addition to that, all of our efforts for individuals that need health insurance, we really go down to that zip code level in the community. This year we changed our Connector Entity program where we required more efforts on outreach, more efforts about being in the community with members from the community to staff it. So it's, again, trying to find folks that don't even know that they are eligible for free or low-cost health insurance. And we found that through the Easy Enrollment Program, the tax program, 72% of people that get coverage through that tax checkoff box are eligible for Medicaid and never knew that they had free health insurance that was available to them. It is a constant challenge to try and find the remaining 200,000 that are eligible and convince them that health insurance is good and we have opportunities for them.
Wonderful. Thank you very much. That concludes this budget. There is one piece of written testimony for everyone in your system, so please read that. And with that, thank you very much.
Thank you.
Next, we're going to do the budget for the Department of Human Services, Social Service Administration, and we'll start with the analysis from Sam Quist.
All right, thank you, and good afternoon, members of the subcommittee. This is the DLS analysis for the Department of Human Services, Social Services Administration. Beginning with the overview chart on the first page of the analysis, the budget for FY24 is $690.8 million, which is about a $13.2 million decrease, or 1.9% compared to the FY23 working appropriation. I'm going to begin on page number 5 of the document, exhibit number 1. This is the first of 3 performance measures that are highlighted in the analysis. Exhibit 1 shows both the rates for the percent of children with no recurrence of maltreatment within 12 months of a first occurrence, as well as the rate of victimization in foster care during a 12-month period. And as shown on the chart, the percentage of children with no recurrence of maltreatment was about 93% in FY22, which is about a 5-point decrease from the previous year. However, DHS has exceeded their goal in this category for the past 3 years. However, the rate of victimization has not met the goal in the last several fiscal years, and DLS is asking in the analysis DHS to comment on further steps that can be taken to reduce the rate of victimization of youth in foster care. Exhibit number 2 on page number 6 is showing another performance measure. This is the rate of placement moves for children in foster care. DHS has a goal of limiting placement moves to no more than 4.12 per 1,000 days, which is the equivalent of a move approximately every 243 days. In FY22, this rate increased to 6.65, which is the equivalent of a move every 150 days. This has been impacted somewhat in recent fiscal years due to impacts of the pandemic that have negatively impacted overall placement stability. The analysis is also asking DHS to comment on plans and steps that it can take to minimize placement moves for youth in foster care. And then the third performance measure that's highlighted in this section of the analysis is related to adult protective services, exhibit number 3. As you can see, the top line on this chart is showing the number of reports of adult abuse, which has increased for the second consecutive year. This is something that was also impacted by the COVID-19 pandemic, and early on there was a decline in overall reporting of vulnerable adult abuse due to less in-person contact. And the bottom line on the chart, the number of cases that are indicated or confirmed consistent with this increase, there's about an 11% increase in indicated findings between FY20 and FY22. I'm going to turn now to the overview of the FY24 budget, which is on page 9. This pie chart is showing, again, the overall budget is $690.8 million. And as you can see, one of the largest categories, the foster care maintenance payments program, is about 46% of the overall budget, or $315.5 million. The next largest category is personnel spending, which is $269.5 million. And the largest area of personnel you can see is the Child Welfare Services Program. Some of the smaller categories that are notable are there's about $8.5 million approximately of funding for evidence-based prevention services, which is consistent to the previous fiscal year, and then the Montgomery County Block Grant, which is funded at about $25.3 million, which this is under a long-standing agreement with the department, with the Montgomery County local department. They receive a block grant from the state to operate their own social services programming for greater flexibility. Exhibit number 5 on pages number 10 and 11 are showing the more detailed line item breakdown of the budgetary changes. So overall, the budget is decreasing by approximately $13.2 million. The largest change is the foster care maintenance program. If you exclude that program, the remainder of the budget is increasing by about $5.2 million. Beginning with the personnel expense section, personnel expenses are increasing by approximately $11.1 million. Some of the components highlighted in this section are the annualization costs for the November 2022 statewide 4.5% cost of living adjustment for state employees. This is about $2.8 million. And then in addition to that, the department is instituting department-wide step increases for various public-facing staff, which is just under $4 million for the FY24 costs for those increases. The foster care maintenance program, I'm going to highlight this more in the slides on the next couple pages of the analysis, but just the high level here is first pointing out that there's $5 million in the budget for provider rate increases for providers with rates set by the IRC, or the Interagency Rates Commission. And then the second, third, fourth, and fifth lines from the bottom of this section of the chart are showing the decreases in foster care placement costs for several of the different placement types. I'm going to talk more in detail about this later on in the analysis, but the overall placement placement costs are trending downward in FY24 compared to FY23. Outside of that area, the other changes in the budget, I'm not going to go through each one of these individually, but I'd like to highlight a couple. The first is that there's a $4.1 million increase in contractual services in the Child Welfare Services Program for the Baltimore Health Suite and other contracts for children's mental health in Baltimore City. And also the Montgomery County block grant is increasing by about $1.3 million. And then the two largest decreases at the bottom of this chart, these are both one-time federal stimulus funds allocated by deficiency appropriation in FY23, about $5 million for adult protective services and $6.5 million for child welfare services. So focusing now on the foster care maintenance payments program in particular, the first exhibits in this section of the analysis, number 6 and number 7 on pages 13 and 14, are showing the average monthly caseload data. Exhibit number 6 is for the various foster care placement types, and exhibit number 7 is specifically for subsidized adoptions and guardianships. Starting with page 6, you can see that there's been a general decline in the number of youth in out-of-home placements through DHS since about fiscal 2016. And prior to the start of the pandemic, between 2016 and 2021, there's an average decrease of about 3% annually. However, in fiscal 2021, corresponding to the start of the COVID-19 pandemic, this rate of decrease grew to about 15.5% that year, and then continued at about 7.3% in FY 2022. In FY 2023 year to date, which goes through December, the rate of decrease was about 1.7%, suggesting that the rate of decrease is slowing to more in line with prior pandemic averages. However, as you can see on Exhibit 6, the overall size of the foster care caseloads are remaining lower than what they were prior to the pandemic. And there's a comment in the analysis that DLS is asking the department to comment on these overall trends and what their projections are for caseloads in the future, if there's going to be any rebounding towards pre-pandemic levels, which is something that was anticipated in the previous fiscal years, or if they're going to continue at this lower level overall. Then turning to exhibit number 7 for the subsidized adoptions and subsidized guardianships. As you can see, these caseloads have also been trending downward in recent fiscal years. However, the percentage declines have been smaller overall. Subsidized adoptions decreased by 4.8% in FY22 and an additional 3.6% over the first half of FY23. Subsidized guardianships decreased by 0.9% and have increased by about 1.4%. So these slower overall rates of decline and actually the increase in subsidized guardianships is reflective of the fact that these two caseloads are dependent on court activity and moving children to permanency through court proceedings, which have had more of a general continuation during the pandemic as courts were quick to reopen. Then exhibit number 8 is showing a summary of caseload projections for 2022, 2023, and 2024. The first column is the actual caseload sizes that occurred during FY22. And then in FY23, there is a comparison both of the estimates that were included in the FY23 budget and then the DLS estimate for the full fiscal year, taking into account the actual experience through December of 2022. And then FY24 is showing the column for the estimates included in the FY 2024 budget. So as you can see for the FY 2023 numbers, there is a pretty notable difference between the caseload projections assumed in the FY23 budget and the updated DLS estimate based on the first half of the fiscal year actuals. There's a decrease. Lower actual experience is suggesting that the caseloads assumed in the formulation of the FY23 budget were higher than what has actually occurred through the first half of the year. And this was based off of projections a year ago at the time of budget formulation that there may be more rebounding of caseload sizes towards what had occurred pre-pandemic than what has actually transpired year to date. And as a result, the FY 2024 caseload projections in the budget are more in line with actual experience. So you can see the FY 2024 budget is pretty notably lower than the FY 23 budget. Then the other item impacting foster care maintenance payments budget is the placement costs for the different placement types. And Exhibit 9 is specifically highlighting 3 of the placement types that have the highest placement costs generally: the purchased home, purchased institutions, and minor mothers and infants. These are both higher levels of care, which typically have higher placement costs. Although the placement costs across all of the various placement types increased by about 15% between the end of FY 2022 and the first half of FY 2023, if you look specifically at the purchased institutions, which is the top line on Exhibit 9, this particular placement cost increased by about 24% during that period. And Exhibit 9, I'd like to highlight, so this is showing the actual placement costs and then comparing the FY24 numbers, what's included in the budget for the estimate. And you can see there's a decline between FY23 and FY24. This is reflecting the fact that the budget is making estimates for placement costs that are slightly lower than what has occurred during the first half of FY 2023, which is indicating that the overall budget forecast for FY 24 could be impacted and may be understating to some extent the actual placement costs going forward, specifically for these higher placement types. So turning to the forecast for the foster care maintenance payments program, which is shown in Exhibit number 10, I'd first start out by discussing FY23. And FY23, DLS is estimating that there's going to be a surplus of about $15 million. And this is primarily related to what I was discussing previously in Exhibit 8 about the overall caseloads assumed in the FY23 budget being higher generally than what actual experience to date has occurred. And this difference is actually large enough that it's counteracting the changes in placement costs in FY 2023. In FY 2024, in contrast, DLS is estimating that there will be a shortfall of about $14.2 million, with the largest category in general funds, and the general fund shortfall actually exceeding overall about an $18.2 million shortfall. The shortfall, as I said, is related to both the estimates of the average monthly placement costs and is also impacted by federal fundability, by the estimate of the state's ability to claim federal Title IV-E reimbursement related to what's assumed in the budget. This forecast is impacted to the extent that caseload sizes change through the end of FY24 and also if there are any additional placement cost changes through FY24. Next, I'm going to turn to the personnel data summary that's on page 18, and I'd like to highlight a couple of things here. The first is the overall vacancy rate based on January 1st, 2023 data. There was a total of about 435 vacant positions, or just under 17% of the total authorized for SSA. This is over double the amount budgeted for the turnover expectancy, about 247 vacant positions over the turnover expectancy, and vacancies have increased by about 93 since the end of calendar 2021. I'm going to discuss more on that later on in the issues section. But turning first to the first issue under discussion in the analysis on page 19, the analysis, this is a discussion of data on out-of-home placements as reported by both DHS and the Governor's Office of Crime Prevention, Youth and Services, or GOCPYVS. They are include components of the former Governor's Office of Children and are also the chair of the Maryland's Children Cabinet, which is an interagency organization which includes DHS and other state agencies involved in the placement of children. They publish an annual State of Maryland Out-of-Home Placement and Family Preservation Resource Plan, and in the FY22 volume of this report, they reported first the data that is highlighted on exhibit number 11, which is the total number of youth statewide experiencing at least one out-of-home placement during the year, which totaled 6,382 across all agencies involved in the placement of children. And for specifically within DHS, the total was 5,794. Similar to the chart that I showed previously, focusing on average foster care caseloads, you can see from Exhibit 7 that the number of children statewide experiencing out-of-home placement has generally trended downward in recent years, decreasing by about 17.6% between FY 2019 and FY 2022. Exhibit number 12 on the next page is showing the placements by placement category. This is specifically within DHS. As you can see, a total of 4,863 of the out-of-home placements made during FY 2022 through DHS were 2 family homes, followed by the second largest category was community-based placements. Exhibit 13 is presenting similar data for the number of out-of-state placements in FY 2022 through DHS, and similar, the largest category is in family homes, followed by hospitalizations and community-based placements. The number of out-of-state placements through DHS has decreased by approximately 14% since FY19, and the majority of these placements occur in states bordering Maryland, including Delaware, Pennsylvania, Virginia, and Washington, D.C. Exhibit 14 on page 22 is showing the overall rate of removal into foster care. In FY 2022, this was 1.2 per 1,000 children under the age of 18, which remained roughly the same as the previous fiscal year. And as you can see, it's been generally declining, corresponding to the decline in the overall foster care caseloads. This is reflective of efforts taken by DHS in recent years to reduce the number of children who need to be removed into out-of-home placements through providing alternative in-home services and other services to their families. Exhibit 15 on page 23 is providing data on re-entry into foster care. Similarly, you can see there's a declining trend of the percent of children re-entering foster care within 12 months of exiting. This chart is highlighting that there's a difference, a notable difference between the number of re-entries for children entering to reunify with their family of origin compared to children exiting into guardianship. And then this section on pages 23 and 24, it also includes a discussion on data that DHS provided over the 2022 interim on factors at removal into care. Based on the data for 1,618 children removed into foster care in FY 2022, DHS has identified that neglect was the most common factor, about at 53% of removal statewide, followed by parental substance and alcohol abuse and housing-related insecurity issues. Interestingly enough, the housing insecurity issue was the largest increase in factors at removal, growing by about 5% since FY 2021. As the report discusses, the category of child neglect is fairly broadly defined legally, includes a number of different factors, and is also highly correlated to family income and economic stability. And the report goes on to discuss data done through research by Chape and Hall, which is a research organization at the University of Chicago specializing in child welfare policy, and research that they've released in the year 2022 has indicated that approximately 60% or more of substantiated child protective services nationwide involve neglect only, and approximately 85% of families investigated by Child Protective Services nationwide earn below 200% of the federal poverty level. This highlights the effectiveness of, for example, family preservation services and other alternative in-home services provided by DHS. As GOC PYVS concludes, these are having a notable impact in reducing the number of children who will need to go into out-of-home placement in Maryland, and corresponding to national academic research that has shown that providing concrete supports to families has a statistically significant impact on this as well. The second issue discussed in the analysis is related to the Family First Prevention Services Act. This has been around for a couple of years now. The largest change under FFPSA is altering the ability of states to use Title IV-E waiver funding for reimbursement for prevention services for children that would not have otherwise been eligible prior to its enactment. These services must be both trauma-informed and evidence-based, and in order to receive federal reimbursement, states, including Maryland, must have submitted a Title IV-E prevention plan. The analysis also notes that DHS has submitted a cost allocation plan to the federal government, which, when approved, will allow retroactive reimbursement through October of 2019. However, the state of Maryland, through DHS, has not yet received approval for its cost allocation plan, and the analysis is asking for DHS to comment on the status of the pending cost allocation plan. Exhibit number 16 on page 26 is showing a summary of the evidence-based prevention practices being implemented by jurisdictions under the FFPSA. There's a total of 17 jurisdictions implementing at least one of these practices, and it was estimated that approximately 253 families were served during the fiscal year. The other main component of the FFPSA was the designation of Qualified Residential Treatment Programs, or QRTP. This is part of the policy change of the FFPSA that seeks to incentivize placing children who are placed in non-family placements in the least restrictive and ideally family-based setting by limiting more intensive services to providers who are designated as QRTP. Throughout fiscal 2021 and 2022, DHS and the Department of Juvenile Services have worked on a QRTP designation process, and in calendar 2022, the first of these providers were designated, and there are currently about 6 statewide. Then the final issue that's discussed in the analysis, we talked about personnel a little bit previously, but this is specifically focusing on child welfare caseworker and supervisor positions. If you turn to page 30, Exhibit 17, this is showing the number of filled caseworker and supervisor positions in child welfare services by jurisdiction compared to the number of filled positions that are required to meet standards developed by the Child Welfare League of America, or CWLA. This is data that the department has reported to the General Assembly for several years now. As you can see from this chart, this is data as of September 1st, 2022. And as you can see from this chart, that DHS is overall statewide meeting the number of positions required as determined by the CWLA. However, this has been impacted by a number of factors in recent years, specifically the overall declining caseloads, which have been impacted by the pandemic, as mentioned previously. The numbers as of September 2022 show that there were about 138.1 caseworker positions and 16.3 supervisor positions over the total amount needed to meet the CWLA standards. However, the analysis points out that the total number of filled positions continues to decline and has decreased by about 117 filled caseworker positions since the same time 1 year ago. At the same time, the number of filled positions needed as determined to meet CWLA standards has increased to about 933.5. This is also varied by jurisdiction, although statewide the number of filled positions meet the standard. At about 6 jurisdictions, there are 6 jurisdictions statewide are failing to meet the caseworker standard, and 7 are failing to meet the supervisor standard. All 6 jurisdictions that failed to meet the caseworker standard had sufficient vacant positions to meet the standard if those positions were filled. As a result, DLS is asking the department to comment on efforts taken to increase the number of filled caseworker and supervisor positions, and specifically addressing these shortfalls in Baltimore and Prince George's counties, which failed to meet the standard for both caseworker and supervisor position types and had the largest shortfall among jurisdictions as of September 1st, 2022. The analysis on page 31 also points out that in recent years, CWLA has recognized that maintaining adequate caseload ratios alone is an insufficient measure of measuring the adequacy of child welfare staffing, and CWLA has pointed out that in addition to simply measuring the number of cases a worker is responsible to, it should also take into account the amount, complexity, and intensity of the work being assigned, and therefore CWLA has indicated that it is undergoing workload studies to develop future revised workload standards. And in recent reporting, DHS has indicated that pending the result of revised standards by CWLA, it would also look into addressing its own standards. The final portion of the analysis document are the recommended actions from DLS. These begin on page 32. There are 6 recommended actions. Briefly go through these to summarize. The first recommended action on page 32 is requesting committee narrative on hospital stays by youth and out-of-home placements. This issue was covered during the DHS overview budget hearing, and the discussion on this issue was included in that analysis, so we did not cover that today, but this committee narrative that's been included in recent fiscal years has been included under the SSA budget code So that recommendation is shown here. This is similar, as I said, this is a similar narrative that's been requested in previous years relating to the number of youth being served in hospitals as well as the length of stays for those youth in hospitals and emergency rooms. The second recommendation is similar to reporting that's been provided by the department recently related to the Family First Prevention Services Act, specifically providing an update at the end of FY23 about practices implemented and the number of families served, as well as providing an update on the QRTP designation process. The third recommendation is related to the implementation of a new provider rate structure. Although I didn't go into this in my presentation today, there is some further discussion on this on page 37 of the analysis based on reporting that the department provided at the end of the previous year. This report would ask for a similar status update as of the end of calendar 2023 on plans for implementation of rate reform for foster care providers. Recommendations number 4 and 5 are annual budget bill language, which restrict the general fund appropriation for foster care maintenance payments and child welfare services to those programs only, and specify that any funds not expended revert to the general fund at the end of the fiscal year. And then the sixth recommendation is relating to child welfare caseload data, similar to what has been reported in previous years. And as I mentioned previously, the number of filled caseworker and case supervisor positions, as well as the number needed to meet CWLA standards. I'm going to end the presentation there, and I think we've covered everything, and I can take any questions at this time.
Wonderful, thank you. Any questions for the analyst? Seeing none, let's bring up the department. Secretary Lopez, you can bring up your team. And though not sworn in yet, we can officially say Secretary Lopez, I think, at this point.
As my boss said, I am the acting secretary until we are sworn in by the governor. So I am acting Secretary Lopez, but we can all laugh a little bit.
My prerogative.
Absolutely, Chairman. Absolutely.
Please begin
Absolutely.
when you're ready.
Thank you. Let me get myself situated here. Okay. Good afternoon, Chairman Resnick and honorable members of the committee. I'm Rafael Lopez, and I'm serving as the acting secretary of the Department of Human Services. Thank you for the opportunity to discuss our budget with you this afternoon. Joining me at the table to my right is Denise Conway, who is the Executive Director of the Social Services Administration, and to my left is Stafford Chipungu, who is our Chief Financial Officer. In addition, I'm joined in the audience by a variety of team members to make sure we are able to answer your questions. First, by Daniel Waite, Acting Deputy Secretary of Administration, Michael Demidenko, Deputy Executive Director for Programs in the Social Services Administration, Kimberly Parks-Bourne, the Deputy Executive Director for Permanency and Placement, Stephen Liggett-Creel, who is the Director of Howard County Department of Social Services, and Cornita White, who's our Director of Anne Arundel County Department of Social Services, but just for a few more hours. Of note, I'll get into that in a second. Of note, we are being intentional about including our partners from all 24 jurisdictions with setting the pace and the tone for the fact that anything we want to do statewide has to be in deep partnership with our 24 jurisdictions. So including representatives from the Maryland Association of Social Services Directors is really important to me and the department. I did want to take a moment to share how thrilled I am that Cornita White has accepted our offer to become our department's new Deputy Secretary of Programs. I trust her judgment. She leads with ethics and integrity. She never shies away from hard work. She's widely respected across the state of Maryland. She understands the delicate balance between state and local partnerships, and most importantly, she's passionate and has a heart of gold. So Cornita represents to me key foundational pillars of how we will lead and create the next generation of human services together. I also want to thank Samuel Quist for his comprehensive analysis, as we've joked about many, many times over these days, and of our department's budget. So you all have our written testimony, which I will not repeat, but I'm going to lift up key elements of that written testimony to make sure we're able to answer your questions that Samuel and others have brought up. So top of mind for me as the newest member of the DHS team are the over 1 million Marylanders who we have the honor of serving every year, as well as the more than 5,000 workers at our department who provide those services. In my first few weeks in this role, it has become abundantly clear that in order to deliver better results for Marylanders, we must proactively support our workers, reduce vacancies, manage our caseloads more effectively, ensure worker safety, and build worker experiences that recognize the importance, their importance in every community across the state. So first, I'd like to turn our attention to the issues that were raised by Mr. Quist, specifically the 6 recommended actions. And in summary, we will, number 1, share actionable data on hospital stays and out-of-home placements. 2, we will provide updates on the implementation of the Family First Prevention Services Act. 3, we will share implementation progress on the new foster care provider rate structure. 4 and 5 are similar. We will monitor and strengthen the use of general funds in the foster care maintenance payment program, as well as for child welfare services at large. And 6, we will persist in how we will maintain appropriate caseload standards that are directly linked to recruitment and retention of caseworkers and social workers. Next, I'd like to turn your attention to the variety of issues you've brought up. The first is issue number 1 on page 5. And this issue specifically is asking us to discuss steps that we are taking to reduce the rate of victimization for youth in foster care. Specifically, the Social Services Administration is currently using a variety of tools to reduce the rate of victimization in 4 key areas. Number 1, increasing the use of data analytics in case management practice. 2, caseworkers increasing their in-person engagement and communication with children in foster care. 3, conducting quarterly monitoring visits for all out-of-state placements. And 4, enhancing the electronic management system to improve accuracy in reporting. Next, we'll turn to issue number 2, which is in page 6 of your analysis. This specifically asks us to comment on the steps that we plan to take to minimize placement moves and efforts to minimize the impacts of these disruptions on the youth in our care. We are currently, as a team, engaged in several strategies to both address the permanency needs of youth in foster care and to minimize all placement disruptions as much as possible. These efforts are currently including pursuing targeted recruitment as well as retention strategies for foster parents, meeting specialized training needs of our foster parents, exploring more formalized mentoring for foster parents, engaging in rate reform writ large, and resubmitting a request for proposals for respite, diagnostic, and evaluation of treatment provision, or DETP services. Finally, also providing detailed jurisdiction data to local department staff to help more effectively evaluate the needs for children in our care. Next, we'll turn to issue number 3 on page 12 of your analysis. This is specifically asking us to comment on the overall trends in foster care caseloads since fiscal year 2021 and whether or not we anticipate any caseloads returning to pre-pandemic levels beyond 2023 or to continue a declining trend. So as we looked at the data, we looked at what's happening not just here locally, but also across the nation, we do not expect the caseloads to return to the pre-pandemic levels next year or in years to come. And quite frankly, none of us should want to see those numbers continue to increase. We want to see a continued downward projection in the numbers and the reformatting of the way in which we engage people across the state in this particular service. We must now strategically serve the needs of children in our care, which are presenting with ever more complex needs, and our kids deserve our boldest thinking as we imagine a different type of response than the department has traditionally given. The Family First Prevention Services Act, or FFPSA, provides us the opportunity to do just that. It allows Maryland to dive deeper into preventative work that will help us ensure that children and their families receive the right kinds of supports necessary to keep them out of foster care in the first place. Finally, the Family First Prevention Services Act Title IV Prevention Plan is currently undergoing review, as Mr. Quist has mentioned, to include the expansion of new evidence-based practices, or EBP, initiatives to better support the needs of the families and children in their homes. I've already expressed to my colleague Denise Conway that as head of the Social Services Administration, I intend to scale more preventative measures and will work more closely with her and our federal partners to expand such access for Maryland. Now on to issue number 4 on page 25 of your analysis. This is asking us to comment on the status of the approval of the cost allocation plan and our ability to seek federal reimbursement for the cap when it's pending. As Mr. Quist already mentioned, the department has submitted a response. Hold on a second, I just realized something. Has submitted a response for cost allocation plan approval in 2020. And as I shared with Denise, it strikes me as odd that we have not received a response yet as we sit here almost 3 years later. That is the office in the federal government that I used to run under the Obama administration. So we are going to course correct that and make sure that we get a response. and understand if they don't like our plan, then tell us what they'd like to see, and we're happy to manage upward. Though we have received verbal approval for our plan, we are awaiting the formal approval in writing, but what we have done already is to make sure that in the interim, the department has been claiming Title IV-E reimbursements based on the proposed plan. So we'll make sure to update the legislature and the governor's office when we get some greater clarity on that. 3 years is a bit of a time to wait. On to issue number 5, page 29 in your analysis. This asks us to comment on the efforts to increase field caseworker and supervisor positions in Baltimore and Prince George's counties, which failed to meet the standards for both types and had the largest shortfalls among jurisdictions for caseworker positions. So a couple things to think about. We presented to your committee a couple weeks ago a much more robust and proactive way to engage how we're going to do more around both worker retention, worker developing on pipelines to make sure we can groom people and promote them within the department, and also to recruit. But specifically, we are going to continue proactively trying to fill those vacancies. And as I said, we've shared that plan with the committee as we begin to make that come to life in the next couple of months. We're also trying to remove barriers to entry to make it easier to work with us. So just the way in which other sectors can do same-day hiring, but for the identification of reference checks and other background checks, we want to do that kind of thing here as well, and we should expect that in our work. We want to continue streamlining processes across the department, proactively market our department to make sure that we are an employer of choice, not an employer of last resort, particularly given the important work that our workers do, and provide a balance of work and personnel well-being to make sure that we offer the most competitive compensation and an environment in which people are really proud to work in. Finally, our Acting Deputy Secretary Dan Waite and Denise Conway, head of our Social Services Administration, will be working with Baltimore and Prince George's County local social services directors to rapidly prototype those strategies in those specific places. Although Brandy Stockdale is not here today, when we testify before the Senate, I invited her to come up to offer her own take, and she was saying that in the few years that she's been the director of the department, she has seen a decline in the kind of applications for people to become supervisors. And one of the things Brandy and I talked about was how to create an environment where we're signaling to our workers that we care about their promotion, care about investing in their education, and want to promote them up, and also attract people from outside the city of Baltimore as well. So those two counties will be working with Dan and Denise to figure out how to make those ideas come to life. And we'll test the ones that work. If they work, we'll scale them. The ones that don't work, we'll toss them. So this concludes our testimony, and we'd be happy to answer any of your questions.
Wonderful. Any questions for the department? All right, seeing none, I have a quick question. One thing that
Yes, sir.
was in the analysis, didn't spend a lot of time in the analysis, but was the drop in actual adoptions, not just fostering. Do you have a sense of the cause of that and what we can do to improve that situation?
Denise, go ahead, please.
Sure. I would like to say that, as Samuel mentioned, that we had to wait for the courts to open up so that those things could be finalized. I would like to think that you're going to see an increase in the amount of adoptions, and also those who have a permanency plan of guardianship come to to have a more permanent status. So I think next year you'll see an increase in both of those areas.
Thank you, Denise. I did want to share, Mr. Chairman, that while I can't speak to exactly why we had that number in the past, I can say moving forward that one of my priorities is to be really thoughtful about how we reimagine adoptions as well, which is that oftentimes, not just the state, but the nation's child welfare system has relied on, one could call it strangers, to be the primary audience of adoptions. And when we think deeply about how to rechange that system, it's about thinking about kin, and not just kin related by blood, but kin from those who are our families or friends who are in our churches or in our communities or in our coaches or in our teams. We can be much more thoughtful and creative about how we think about adoptions and have to and develop a system that's much more robust than what we've had.
Wonderful. Is there any other questions? Seeing none, thank you all very much. We do have a panel to testify afterwards of 3 people, so we'll call up Kevin Keegan of Catholic Charities. Sorry, looking for it. Teresa Hessler for Marfie, and Tammy Morningstar from AFSCME Local 112. Mr. Keegan, begin whenever you're ready.
Chair Resnick, members of the committee, Thanks for the time. My name is Kevin Keegan. I am the Division Director of the Family Services Division at Catholic Charities in Baltimore. First of all, I want to say that we are incredibly excited about the new leadership of the department. And as I mentioned across the street last week, we are particularly pleased with his first choice of naming Carnicia and stealing her away from Anne Arundel County, although I'm sure people in Anne Arundel County are not happy about that. But I know that statewide we are. But we are here to express our full support of not only the department's efforts, but of SSA's budget, as well as I'll explain, an increase to the provider rate for those private providers providing foster care services. Over the past decade, the system of care to support Maryland's children has really crumbled before it was fully formed. There was, I think, a very robust plan back in 2008 that began to be implemented, which greatly reduced the use of high-end group homes, RTCs, residential treatment congregate care facilities. And in tandem with that, the expectation was to build a strong system of community supports to support families, and particularly in staying together and reducing kids coming into care, and also reducing kids who needed higher ends of care. While there were some good initial efforts over the past decade, those community services have really kind of crumbled, as I said, before they even got fully built. I am encouraged to hear of the vision of the new administration, the new governor, and particularly the idea of a system of care which is built primarily on family voice, really respecting that families are the experts on their kids. And the reality is that, yes, we have a lot of parents out there who maybe are found to have neglected their child, but it isn't because they've chosen to neglect their child. They've been, let's just say, their priorities have gotten in the way, primarily related to substance use and behavioral health issues. And the reality is that the systems, the social services system, the child welfare system, and the behavioral health system absolutely have to perform hand in hand and work together to do the work we need to do. We at Catholic Charities, consistent with what I've just explained, we've reduced our residential footprint from 190 beds to 75 beds. And we've done that in tandem with expanding the breadth of outpatient community behavioral health services that we provide now to include substance use services, to include partnerships with local departments of social services in Allegheny County, Anne Arundel County, Baltimore City, Baltimore County, where we're providing family first approved, evidence-based practices that are really designed towards keeping families together. And while statewide things have struggled, if you look at local departments, you'll see some really positive work that continues or that really has happened at the local departments. The issue of provider rates in particular, especially as we've reduced the number of kids that are in residential care, it's hard to even explain to you the challenges of the kids that we do have and the trauma they faced and the behavioral health challenges that they are dealing with. The behaviors are significant. The challenges to our staffing are just profound. And as you've heard from many other fields, I know, having enough staff to even keep your program open is our first goal every day as we struggle to hire people. So a number of the other areas, say Medicaid rates, our DDA rates, are looking at 11 and 12% proposed increases. Right now, there's a 4% increase built into the foster care budget for provider reimbursement rates. So we do respectfully request that we consider we're facing the same hiring challenges as everyone, the same minimum wage challenges as everyone. So I would just respectfully request that we consider that as well. And with that, I'll conclude and say thank you for the time.
Thank you. Morningstar.
Thank you. I appreciate being here today. I'm Tammy Morningstar. I've worked in the Baltimore City Department of Social Services for 34 years, the most recently 12 years at the Ready by 21 program as a disability specialist, probably the job of my dreams. And I'm a proud member of AFSCME Local 112. I would like my coworker to introduce herself, please.
Good afternoon. Larice Jones, Case Manager 2 at Baltimore City Department of Social Services.
Thank you, Larice. I'm here to present to you two initiatives that are coming not just from me, but from my coworkers. and I will explain to you why we started working on this. We really believe that a DSS-sponsored transitional housing placement or youth awaiting placement is absolutely necessary. We are currently dealing with many youth who are refusing the placements we offer or for whom we cannot find placement. They are spending time in the community. They are spending the days at my program at 1920 North Broadway, and then the evenings and the weekends at after hours, which is not a place for a youth to be, and not providing the service needed. Or we are placing them in hotels and motels where they do not get the services they need, they have no structure, and it is not helpful. The program we are suggesting would be one DSS sponsored, have case managers and social workers trained in crisis intervention, be a 24/7 program, and having mental health therapists on site, or at least have contact with the youth on a daily basis, and the agency already employs those people. It would be for our youth who are in the community engaging in high-risk behaviors, who are making poor decisions in their lives right now, and who have a hard time accepting the need for the services we can provide, but it would give us an opportunity to reach out to them and at least start the process. And then they could be with us until we find an appropriate placement for them. The second thing I think is very needed is a comprehensive workplace violence prevention program. I say that from the standpoint not just of learning de-escalation techniques and issues of that nature, but also in looking at our policies and procedures every day, what we do, what is expected of us in our offices and in the field, and what could be done to assure the safety of myself and my coworkers. Why is this important to me? I would like to show you something that happened to me in September of last year. I was on staff at Ready by 21 on the front desk, supervising youth who were in our agency awaiting placement. Placements had been offered to them, but it wasn't a placement they wanted to accept. They were dysregulated. Supervision was somewhat difficult. But in my attempt to assure the safety of another foster youth, I was assaulted by a youth. The assault resulted in a concussion and all that encompasses. And the attack was observed by security in our agency. Security clearly states to us they are there to protect the facility, not staff. There was no intervention. I want to make clear I don't lay this at the feet of the Ready by 21 leadership. I respect and admire them, and they have offered me all the support available. Keyword there is available. There is not much. And I am concerned about my caseworkers, my brothers and sisters, and I would like there to be an increased support for them. I have the luxury, because of the years I've worked, that I could retire. Most of my brothers and sisters don't. Some do. I'm not ready to retire. I still have good to do in me with the youth that come to the Ready by 21 program, and I want to do that. And I don't leave men on the battlefield, which is one of the reasons I'm here today. My coworkers are afraid, they are frustrated, and they are leaving. Who they turn to for support and for comfort in times of crisis are each other. All we have is each other. That's how we feel. Assaults are increasing in frequency and intensity. This is not an isolated incident. I just spoke up. It is inevitable to me that a tragedy is going to befall one of us. And it's going to be so serious that wearing a goofy headband is not going to be able to cover it up. I am fearful of that happening. We all are. So I come to you with two initiatives I feel could help in keeping that from happening, although I'm certainly open to all ideas. But I ask for your support in considering these initiatives and looking at other things so you can help me assure that it doesn't happen. And I thank you.
Thank you. Not seeing Teresa Hessler, so I'm going to ask if there's any questions for this panel. Seeing none, thank you all very much for your testimony. We appreciate it. And that concludes the hearing for today, so we are adjourned. Thank you.